A gut feeling about thrombosis. Thrombosis definition. Thrombosis is the process of a blood clot, also known as a thrombus, forming in a blood vessel. This clot can block or obstruct blood flow in the affected area, as well as cause serious complications if the clot moves to a crucial part of the circulatory system, such as the brain or the lungs. It is normal for the body to produce clotting factors like platelets and fibrin when a blood vessel is injured, to prevent an excessive loss of blood from the body. If this effect is overproductive, it can obstruct the blood flow and form an embolus that moves around the bloodstream. Now a short video explaining the process of a thrombosis.
The heart pumps blood to the body through a complex network of arteries. With the exception of the coronary arteries, which nourish the heart itself, most arteries transport oxygen-rich blood away from the heart. Circulating in the blood are red blood cells, white blood cells, nutrients, and other life-sustaining substances. Cholesterol and other fatty substances also circulate in the blood. Over time, these substances can be deposited in the artery walls, a condition called atherosclerosis. The deposited cholesterol, or plaque, can build up over time, causing hardening and narrowing of the otherwise smooth artery walls. When the walls of the artery become narrowed and hardened, blood flow is restricted. As the plaque accumulates, the buildup can become unstable and may break off or rupture. A condition called thrombosis results when blood starts to coagulate or clump together at the site of the rupture, similar to the way blood clots to stop bleeding from a cut. The blockage or thrombus can grow larger, further restricting the flow of blood. The thrombus is also in danger of breaking from the site and traveling through the arteries. The blockage caused by a thrombus can be life-threatening. A blockage in the coronary arteries may cause a heart attack, while blockage in the cerebral arteries may cause a stroke. Blockage in one of the major arteries of the body can prevent blood flow to an extremity or organ, causing pain and tissue damage to the area.
Thrombosis types. Thrombosis can be broadly classified as either venous thrombosis or arterial thrombosis, according to where the thrombus presents in the body. Venous thrombosis occurs in the veins and is categorized further according to where it occurs, including deep vein thrombosis, portal vein thrombosis, renal vein thrombosis, jugular vein thrombosis, Budd-Chiari syndrome, cerebral venous thrombosis, also arterial thrombosis known as arteriothrombosis due to its association with atheroma rupture occurs in the arteries. The blood stasis caused by atrial fibrillation may also cause this type of thrombosis. Thrombosis causes. There are three main causes of thrombosis: hypercoagulability, injury to the endothelial cells of the blood vessel wall, and abnormal flow of the blood. Hypercoagulability, also known as thrombophilia, refers higher levels of coagulation factors in the blood that increase susceptibility to thrombosis. It is usually as a result of genetic disorders of the immune system. Injury to the epithelial cells of the wall of blood vessels after trauma, surgery, or an infection can also precipitate coagulation and possibly thrombosis. Abnormal blood flow, such as venous stasis following heart failure or long periods of sedentary behavior, can also cause thrombosis to occur. Thrombosis complications. A common complication of thrombosis is hypoxia, due to the obstruction of the artery or vein. When the majority of the blood vessel is blocked, the oxygen supply to the body is reduced and results in increased production of lactic acid. Additionally, in some cases, the blood clot may break free and travel around the body, a process known as embolization. This can obstruct the blood flow to essential organs such as to the brain or the lungs, reducing or inhibiting oxygen and blood flow with several repercussions. Now a video explaining the thrombosis.
Such as vessel damage, arterial or venous stasis, or by plaque rupture, resulting in the exposure of active tissue factor on the vessel wall. A cascade of biochemical processes is mobilized that leads to the activation of serine protease factor 10, the first coagulation factor in the common final pathway. Activated factor 10A is a principal component of the prothrombinase complex, which cleaves prothrombin to explosively generate thrombin. In turn, thrombin then converts fibrinogen to fibrin, thereby creating and stabilizing a thrombus. In the otherwise healthy individual, a number of inhibitory mechanisms in the healthy, intact endothelium, such as the constitutive expression of thrombomodulin, restrict the accumulation of preformed thrombin to the site of injury, thereby preventing excessive thrombus generation and vascular flow limitation.
Thrombosis prevention. The use of heparin following surgery is common if there are no issues with bleeding. Generally, a risk-benefit analysis is required, as all anticoagulants lead to an increased risk of bleeding. In patients admitted for surgery, graded compression stockings are widely used, and in several illnesses, prolonged immobility, and in all orthopedic surgery, professionals' guidelines recommended low molecular weight heparin, known as LMWH administration, mechanical cuff compression, or the insertion of a vena cava filter. Thrombosis treatment. The treatment of thrombosis depends on whether it is a vein or an artery, the impact on the person, and the risk of complication from treatment. It includes anticoagulation, thrombolysis, surgery, endovascular treatment, and antiplatelet agents. Now a video explaining a special treatment of vein thrombosis.
Dr. Durga Prasad, Professor HOD, Department of Cardiac Surgery, Villacres. DVT can be prevented. The chances of recurrence DVT is very high. Actually, there are a lot of school of thought. Some say only 3%, but actually it's 10 to 30%. Thing is, DVT can be prevented if you think that you had once DVT. That means anticoagulation. You have to take medication to thin your blood. It has to go, you have to take like something like what you call aspirin, clopidogrel, what you call blood thinners. You have to continue this medication. Then you have to have a good lifestyle, walking, and you have to wear stockings, compression stockings, and you have to prevent from loose motion, because once you have loose motion, all your will be a lot of dehydration and the blood flow is impeded. So the DVT is high chances of getting into DVT. DVT can be prevented. Smoking should be avoided. Quitting smoking. Good vegetable diet. Good exercise. Good lifestyle. That will create good blood flow. Always when you sit for a long duration or sleep for a long duration, you have to make sure you keep moving your legs or something so that the blood flow is not clogged at one end. This is seen in people who travel for a very long distance or sit for a very long distance.
Thrombosis conclusions. Once thrombosis has been diagnosed, the goal is to address the immediate life-threatening concern of blood clots breaking free from the legs and traveling to the lungs. A blood clot in the lung is known as a pulmonary embolism. A dangerous condition that can cause pulmonary embolisms can cause shortness of breath, chest pain, and even sudden death. Anticoagulants, also known as blood thinners, are nearly always the first line of treatment for DVT. Rarely are the symptoms of DVT so severe that more aggressive treatment is needed. For patients who require other treatment options, an IVC filter can be inserted by endovascular specialists to catch DVT clots that may travel toward the lungs from the leg or pelvis. Thank you.